Welcome back. In this video, we're going to finish up our discussion of the endocrine system, starting with the thyroid gland. And the location of the thyroid gland is something that we looked at already in the dissection of the rat. So you guys identified this thyroid cartilage. And just below the thyroid cartilage is the thyroid gland. And actually, you can feel your thyroid. So if you find where this protrusion of the thyroid cartilage is, this little knob right here would be the Adam's apple. It's more prominent in men than in women, but we all have that thyroid cartilage. And then if you just take and run your fingers below that, you'll feel this little squishy mass right there. And this little squishy mass is my thyroid gland. The thyroid gland, if you were to section it and look at the histology under the microscope, you'll see that it has a few different cell types. So you have these spaces or lumens. As surrounding the lumen, you have cells which are called follicular cells. And these follicular cells make thyroid hormone, which is actually two different slightly different types of hormones, T3 and T4. T3 is a more active form of thyroid hormone. A lot of the T4 gets converted into T3 at the target cells. And the synthesis of thyroid hormone by the follicular cells requires iodine, and that is why you have iodine added to salt in the United States and in many countries all around the world. Then you have a few other cells interspersed in between these follicular cells that are parafollicular cells, not lining the lumen, but on the outside of the follicular cells. And these guys make another hormone that we've already talked about previously called calcitonin, which is going to function regulating blood calcium. So let's take a look at thyroid hormone. Like most of these hormones that we've been looking at, the pathway starts in the hypothalamus, and then we go to the anterior pituitary. So the stimulus for thyroid hormone release is going to be cold. So you release more thyroid hormone during the winter. Pregnancy, hypoglycemia or low blood sugar, and also low thyroid hormone levels, because you're trying always to reach homeostasis. And as we talked about way at the beginning of last semester, the main center and control of homeostasis is your hypothalamus. So when these stimuli are received by the hypothalamus then releases thyroid releasing hormone. That is released onto the anterior pituitary, and the anterior pituitary then releases thyroid stimulating hormone. That goes to, of course, through the blood, and then it interacts with the cells that have receptors for it on the thyroid gland. And then the thyroid gland is going to produce thyroid hormone, which is T3 and T4. Thyroid hormone then is going to interact with its effectors, many cells throughout the body, to cause an increase in the metabolic rate and increase in cell glucose uptake, and that's especially true for neurons. It's also going to promote the breakdown of fat. It's going to cause an increase in respiration rate, an increase in heart rate, and an increase in the contraction force of the heart, and finally will increase your body temperature. It makes sense, right, that this is going to be released in the cold because it's raising your body temperature. If you have too much thyroid hormone being released, this is a disorder called hyperthyroidism. And there's a few characteristic symptoms. Like particularly weight loss, heat intolerance because your body temperature has been raised, bulging eyes, hyperactivity. And this can be caused by ingestion of exogenous thyroid hormones, or some people abuse thyroid hormone, like if they're trying to lose weight, or if you have a loss of feedback control in your thyroid. This is a disease called Graves' disease, and this is either removed by giving anti-thyroid drugs, or by surgically removing the thyroid, and then because you don't have any thyroid hormone anymore, you would need to take hormone supplements or thyroid hormone, in a pill form for the rest of your life. The other side of that coin would be hypothyroidism, where it results when you have a decreased production of thyroid hormone. And this can be a result of not having enough dietary iodine, which is something that happens usually in poorer areas or less developed countries, because we have fortified our salt for the most part with iodine. There have been some new cases I have heard, and I have not looked at the data for that, but because these things like Himalayan rock salt and sea salt have become very popular, so some people have stopped using iodized salt, and so they are not getting sufficient dietary iodine. Can also result from autoimmune destruction of thyroid cells, and that disease is called Hashimoto's thyroiditis. And you would treat that or any hypothyroidism with exogenous thyroid hormone. If you have low thyroid hormones, this is going to be similar in many ways to the symptoms of depression. So if you feel like real lethargic or dull and apathetic, and you go to the doctor, they will test you for hypothyroidism, usually before referring you to, psychiatric care or to a counselor. So going along with this, you have, as I said already, lethargy, cold intolerance, and oftentimes weight gain as well, low metabolic rate, and just kind of feeling slow. If you do not have sufficient dietary iodine, this can result in enlarged growth of the thyroid gland, which is called goiter. And the reason that happens is because if you do not have dietary iodine, this is going to result in low levels of thyroid hormone, which, remember, is the hormone produced by the thyroid gland. If you do not have sufficient thyroid hormone, this is not going to provide negative feedback on thyroid stimulating hormone release. And as a result, you're going to end up with high thyroid stimulating hormone being released by the anterior pituitary. So this thyroid stimulating hormone is attempting to raise the thyroid hormone levels, but it's never going to happen because there's not sufficient iodine to synthesize thyroid hormone. In addition to stimulating production of this hormone, it's going to stimulate the cells that produce that hormone in an attempt to raise your thyroid hormone levels, and that is going to cause growth of the thyroid gland. Congenital hypothyroidism is caused when you have a lack of the thyroid hormones, either before birth or in early development, maybe because you don't have a thyroid gland or the mother was not ingesting iodine. And this can result in severe mental defects and stunted growth, as you can see in these people in this picture. And if you were aware that you had a child that have this condition, you could treat that with exogenous thyroid hormones. The other hormone that's produced in the thyroid gland is calcitonin. Calcitonin is going to be stimulated, its release will be stimulated by a high blood calcium level as well as by exercise. And so then the thyroid would release calcitonin. And that will have an effect on the kidney and your bones. And overall, it's going to reduce blood calcium by inhibiting the activity of osteoclasts and by increasing the amount of calcium that's going to be excreted in your urine. And remember, as we talked about previously, parathyroid hormone also causes an increase in blood calcium levels. Okay, the adrenal glands are glands that sit here above your kidneys. So renal refers to the kidneys, and ad is saying it's on top of. So you can see here one of the adrenal glands, and you have two as you have two kidneys. And the adrenal glands produce a couple of hormones we've already seen, epinephrine and norepinephrine, which are produced in the inner part of the adrenal gland, which is the medulla. And then the cortex produces a bunch of corticosteroids. Cortico is coming from the cortex. So here you can see a little bit more detailed anatomy of the adrenal gland. Again, the inner part of the adrenal gland here is the medulla, and that produces epinephrine and norepinephrine, and that those hormones will be released by sympathetic nervous system stimulation. The cortex will be this outer portion of the adrenal gland, and it produces more than 20 different types of corticosteroids, which are lipid soluble because they are steroids. And those corticosteroids fall into a few different categories. Mineralocorticoids regulate your electrolyte or ion balance. One example is aldosterone. We'll talk about them more. There's a whole chapter on electrolyte balance we'll get to later. Glucocorticoids help to regulate blood glucose, inflammation, and also your immune response. And an example of that is cortisol. And if you're taking a steroid for inflammation, like dexamethasone, prednisolone, then that is an exogenous glucocorticoid. Then the gonatocorticoids produce androgens, which are male sex hormones like testosterone. And in the female, this is the primary, not the only, but it's the primary area of androgen release. So that's why females have testosterone, because they are making testosterone in the adrenal glands as well as some in their ovaries. It's a secondary area of androgen release in males because, of course, the testes are making most of the testosterone and other androgens in males. So let's look at one example of a glucocorticoid, which is cortisol. This is going to be released when you're encountering a stressful situation, and it also has a cyclical release so that it increases normally during the late night and early morning. And this begins in the hypothalamus with corticotropin releasing hormone, CRH. That travels to the anterior pituitary, which is going to release ACTH, adrenocorticotropic hormone, which then goes on to interact with cells in the adrenal cortex, causing the adrenal cortex to release glucocorticoids like cortisol. Cortisol and other glucocorticoids are going to overall increase all blood nutrient levels, and they do that through promoting protein catabolism, or breakdown of proteins, adipose catabolism, or fat breakdown, and glycogen catabolism, or glycogen breakdown. And just this, I know I said this already, but bears repeating, when you break down glycogen, what do you end up with? You end up with a bunch of glucose, because glycogen is a storage form of glucose. And if you have cortisol present in high doses, this is going to reduce inflammation, which is normally why we would take exogenous glucocorticoids. And it will also suppress the immune system, which is often an undesirable effect of glucocorticoids, but sometimes people will take it on purpose to suppress your immune system, like if you have a transplant or something like that. There are several disorders which are manifested from problems in adrenal cortex hormones. Cushing's syndrome is something that happens when you have chronic exposure to excessive glucocorticoids, and this happens if you're taking corticosteroids either in high doses or for too long a period of time. And so sometimes people will take steroids, corticosteroids, for inflammatory conditions which have no other treatment. But it's a dangerous thing to do because the side effects can be very severe and long-lasting, and they include obesity, hypertension or high blood pressure, excessive hair growth, kidney stones, menstrual irregularities. Addison's disease results from failure of your adrenal glands, and so you end up with a shortage of glucocorticoids, and this results in weight loss, fatigue and weakness, low blood pressure, and skin darkening, and that can be treated by taking exogenous oral corticosteroids. When I say exogenous hormone, that just means a hormone from outside of your body. So the endogenous hormones are the hormones that your own body produces, and an exogenous hormone would be one that you take from outside of your body, like in a pill or injection, or otherwise take in a synthetic or pharmaceutical hormone. Okay, moving on to the pancreas. That's this kind of leaf-shaped structure here, which is sitting right on top of the duodenum of your small intestines, which is the first part of your small intestines. The pancreas is mostly an exocrine organ and is going to secrete a bunch of enzymes and other things that are going to be used in digestion. But there are little islands of cells inside of the pancreas called pancreatic islets. They're called pancreatic islets. So here you can see this pancreatic islet, and these are endocrine cells within the pancreas. And you can see, for example, that all of these other guys here are going to be parts of exocrine secretions, and then this guy, the pancreatic islet, contains those endocrine cells. And there are two main cell types within the islets that we need to know. The alpha cells produce glucagon, and then the beta cells produce insulin. These two hormones have opposite effects on blood glucose, and together they maintain your blood glucose at a level between 70 and 110 milligrams per deciliter, unless you have diabetes or a similar problem with blood glucose. So insulin, as we're going to see, lowers blood glucose, and then glucagon raises blood glucose. So we'll start here with insulin, which, as I just said, functions overall to lower your blood glucose. And so the stimulus for insulin release is going to be an increase in blood glucose, which usually results just from eating. And so when your blood glucose goes up, the beta cells in your pancreas are going to release insulin, and that insulin is going to travel through the blood, as all hormones do, to have effects on cells with receptors for insulin, which includes all of your cells. In particular, we'll see effects on muscle cells, adipose, and effects on blood glucose, of course, in all of your cells. So the overall effect of insulin is going to lower your blood glucose, and it's doing this by promoting or increasing glycogenesis. Again, you're taking glucose and building it up into the storage form, which is glycogen. So you're removing glucose from the blood into the storage form, which is glycogen. It also promotes uptake of glucose by your cells. At the same time, is promoting lipogenesis, or synthesis of new fat, and protein anabolism, or building of new proteins, like in your muscle cells. So whenever you have an inadequate uptake of glucose from your blood, you have high blood glucose. This disorder, or this group of disorders, is called diabetes mellitus. That elevated blood glucose can lead to damage of your blood vessels, also to retinal blindness, kidney failure, and finally, that is the leading cause of non-traumatic amputations in the United States. Type 1 diabetes has an autoimmune component where you destroy your own beta cells in the pancreas, so they are no longer able to produce insulin or no longer able to produce a sufficient quantity of insulin. And that tends to occur in children and younger people. And people with type 1 diabetes require daily injections of insulin, and so you'll see people with type 1 diabetes are constantly monitoring their blood glucose levels, like with a pinprick, and they measure blood glucose levels, and then if they fall low, they will need to inject insulin. The other form of diabetes is type 2 diabetes, in which obesity is a major cause. And so this results from a decrease. This results in a decrease in insulin effectiveness, and may also result in a decrease in insulin release. So obesity is a major cause, and this tends to occur in older people. But as obesity increases in the younger population in the United States and many places in the world, then you'll see type 2 diabetes going up in younger people as well. Okay, a moment ago we talked about insulin, which lowers blood glucose, and the opposite side of that coin is glucagon, which raises your blood glucose. So the stimulus here is going to be low blood glucose levels. When that occurs, the alpha cells in your pancreas will produce glucagon, and glucagon is going to function to increase blood glucose by promoting the breakdown of glycogen, and it also promotes the breakdown of fat. Okay, that's all of the endocrine glands I want to go into detail on. So there are, of course, a number of other glands, and I just want to mention them quickly. Some of these we have already seen and we've already talked about. So, for example, the pineal gland we looked at when we did our brain dissection. That releases melatonin, which governs your sleep-wake cycle. The parathyroid gland are these 4 little nodules that are on the back of the thyroid gland. Remember, this is the thyroid gland, so they're sitting there on the back of that thyroid gland, and they release parathyroid hormone, which we've already seen increases blood calcium levels. The thymus is this structure here that sits on top of the heart, and that releases thymic hormones, which have a role in the maturation of T cells in your immune system, and we'll talk about that a little bit more when we talk about the immune system. Your heart releases ANP, natriuretic peptide, which functions to lower blood pressure. So when blood pressure is high, that causes stretching in the atria, and then your heart will release ANP, which will lower blood pressure. The kidneys release a hormone called erythropoietin, which increases red blood cell production. And this is something that has been in the news because Lance Armstrong and other long-distance athletes have used EPO to increase their red blood cells, to increase their capacity to do, long-distance types of exercise. The liver produces angiotensinogen, which in a somewhat circuitous way functions to increase blood pressure. The stomach releases gastrin, which is a hormone that increases digestive activity and smooth muscle activity in your stomach. Small intestines releases cholecystokinin and secretin, which increases digestive activity and smooth muscle activity in your intestines. And we'll talk more about these digestive hormones when we talk about the digestive system later on. Skin is involved in the production of calcitriol, which raises blood calcium. And then adipose produces a hormone called leptin, which has a role in regulating your food intake and may have a role in producing that feeling of satiety or fullness. Okay, so that is it for the endocrine system. I'll see you in the next one.